disclaimer that says some things are exaggerated for.
I will do that.
So on a slide,
have been exaggerated for effect.
Yeah.
So on my
That's
slide,
funny.
my regular flea is this big.
Yeah.
So my other flea, right? But there's no way they're that big.
That's
I think
what
they're
I'll
maybe
put.
5
I'll
centimeters.
put a little
Still
line.
impressive.
I'll put a little line that says some things have been
Okay,
exaggerated.
great. Yeah.
No worries.
Sorry for Saying Sorry Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Jolle Kirpenstein, talented surgeon and social media geek.
Hi, this is Dr. Susan Little.
And this is Dr. Jolle Kirpenstein.
And Dr. Susan Little, too.
Oh my, we have two Dr. Susan Littles here. This is part 2 of our Dr. Susan Little and Dr. Susan Little podcast.
And it's such a joy for me. It's a joy for me to know you. It's a joy for me that you're such a great person. We've gotten to work together before, and now we get to interview and do a podcast.
Absolutely.
Yeah.
I couldn't have a better alter ego than you,
And
Susan Little.
I think it's a joy for me because now I know Dr. Adam Little, Dr. Susan Little, and Dr. Susan Little. So there's so many Dr. Littles in my
We
life.
have a little family.
Yeah.
I know.
We'll have to
I
introduce
know.
you to Adam if you've not met him.
I know.
Yeah. There's
And
another
then
one.
there is a, so you have the size, Adam,
Oh, Adam
and
is
then
very
Susan,
tall.
and then Susan. So it's perfect. So
Excellent.
So I want to take one step back once again for our audience. Tell us a little bit about anaplasmosis, how they can recognize it, what diagnostics they have to do, and what the treatment is.
Yeah, so for Anaplasma phagocytophilum, again, you recognize from a fever, from lethargy. You might see, if you're doing blood work already, then you might see some thrombocytopenia. But the cats are depressed. They're clearly ill, and then that high fever. And then on a blood smear, you do have a chance of finding the morula inside neutrophils. So you'll see the neutrophils, and then you'll see that inclusion of the bacteria, basically. So it's worth doing the blood smears. For some of the Ehrlichia species, they're so hard to find. You know, we get out of the habit. But for Anaplasma, it is. But then we also have serologic tests that we can do. So the patient side tests that are labeled for dogs can be used in cats, and they will pick up the antibodies. If you're very early in the infection, the patient may not have seroconverted yet, but it's still worth looking in the blood smear, looking for antibodies, and then there's PCR available too from the
Which would
labs.
detect them earlier, probably?
Yeah, the PCR will pick up the early infections, the antibodies, the later infection. If you're in that sweet spot where they have had an antibody response, you might get it positive on both.
And do you have the reservoir thing in cats with anaplasmosis too?
So cats aren't the reservoir for the tick.
No,
They're-
I understand, but
yeah.
can cats be carrier without clinical signs?
Yeah, so a lot of cats seroconvert without clinical signs or without the owner perceiving clinical signs.
Or maybe not dramatic ones,
Yeah,
right? Yeah,
and that's a challenge too with Lyme disease is they seroconvert and we say, oh, but they're clinically normal, but we didn't check them every day, right?
Maybe they were off a few days. It's too subtle.
Right. And then they respond to antibiotic therapy, and we use doxycycline. The warning, of course, with doxycycline in cats is make sure to give it with fluids so that they don't get those esophageal strictures.
Yes,
so I'm sure you have some
I'm
tricks
so glad. I was talking about this at a lecture recently. So yeah, if doxycycline is given in liquid form, it's not an issue. But if you're giving it in pill or capsule form, it's one of those drugs that's very irritating to the esophagus.
Right.
And they get stuck.
It gets stuck. And of course, cats don't drink an 8-ounce glass of water with their pill, and that prolonged contact will cause esophageal damage. But it's easy to avoid, if you just, even a little snack, a treat, anything at the same time as the pill, will prevent that. So thank you for mentioning that. It's really important.
For sure. Well, especially because if we're going to be treating them for 4 weeks.
There's the other thing. Then it's not a week of treatment. It's 4 weeks of treatment. So with 4 weeks of treatment for Anaplasma phagocytophilum, do we eliminate the organism?
Well, from the data that we probably have more data on Ehrlichia. And so if you stop sooner, you haven't eliminated the organism. But I'm never really convinced we've eliminated the organism at all. Yeah. But what we do is give the cat's immune system a chance to overcome. We certainly they respond for disease within a day or two. Yeah. And so we certainly see a clinical response, but then we continue that 4 weeks. If you stop earlier, you're more likely to have recrudescence of both disease, clinical signs, and infection. And then we think we eliminate most of the infections, but you might have some cats that are persistently infected.
Are they then immune for life?
So probably for that homologous strain of Anaplasma phagocytophilum, but there's a whole lot out there in the world. It's a very diverse group. Same with Borrelia. There's a lot of different strains out there. Okay. So the short answer is no.
Yeah, so tick control.
Yeah, absolutely tick control.
It always circles back to tick control.
And let's go there a little bit. So what kind of tick control? So let's look at the 3 types of cats. The cat that is in the house, what would you do? The cat that is occasionally outside, and the cat that's outside all the time.
Right. So I think all of them need tick control for sure. And then there's a few different options, and I would do what would work for that cat.
Because there are options.
Yeah, and you have to work with the cat. So there's collars that are available, and they're good collars. I'm sure there's still bad collars available. But
but these are good collars.
These are good collars that last 8 months. It's a flumethrin and imidacloprid combination.
And how do people know, how do you educate your client of a good versus a bad collar?
Yeah.
So they have to be safe. And then the collar that we're talking about, the Seresto collar is what we're talking about, is safe because it will break away. People worry the cat will get trapped or hung up on the collar, especially if they're outdoors.
We have wonderful reconstruction techniques.
Yola never misses an opportunity to get a surgical angle.
Surgery. Yeah, they get stuck under the axilla, and then they have
but
this.
We'd rather that not
We'd
happen.
rather that not happen.
So we want the breakaway
So these collars will break away.
Yeah.
But I think it is important that, so we know a couple of things about collars in general. We know that if the collar is put on at the veterinary clinic, that the compliance is higher, any type of collar. And so that gives the veterinary team, the opportunity to talk to owners about the collar, and there might be a few days of discomfort, or, maybe we're going to ease it onto the cat. It'll wear it like an hour the first day, 2 hours the second day. There's lots of tips and tricks.
Right.
So collars can be put on cats.
And this is really important because I think you're a big proponent of having collars on cats anyway.
Yeah, for ID.
For ID. And so we talked about kitty kindergarten with our previous guest.
With Steve Dale.
So we need to teach them early that it's okay to wear
a collar.
Right.
And this is another great benefit. So you can get tick control. But there's other formulations. There's other products.
Absolutely. And so if you're dealing with an adult cat that you can't convert to a collar for whatever reason, the owner doesn't want them to wear a collar, or an indoor only cat maybe where it's not as critical for the identification, then there's topical formulations that are systemically absorbed of these new isoxazolines. So there's a ceralaner that's combined with selamectin.
Yeah,
so you get
it's an exciting product.
Yeah, so you get the full gamut of parasite control. And then there's fluorolaner, which is systemically absorbed flea and tick control with that 12-week efficacy. So that's very exciting too. So there's ways to get cats protected.
And they're good products.
They're excellent products.
So that's not the issue. The issue is awareness and getting it on the cat.
And it's interesting because, the products have improved so much in the last 10 years, I would say.
Yeah.
Are you worried about your future job?
So when I was in veterinary school and shared that I was going to be a parasitologist with my classmates, I had a classmate tell me, there's not going to be any parasites in a couple of years. This was 1990.
This is a good career choice.
Yeah, this was 93. And her idea was, she said, you've heard of ivermectin, right? There'll be no more parasites. And I said, I think it'll be okay.
Yeah.
I think it'll be all right.
Yeah, wait until the return of the giant flea
Parasites
of 25
are
centimeters.
all of us.
Yes.
Yeah, absolutely. That's too funny, though.
Yeah. So I do think, unfortunately, they'll find a way. Compliance is always a challenge, right? So convincing owners that this is important.
Yeah.
We have found that one of the predictors of if an owner will purchase and use tick control is if the veterinarian or the technician removes a tick from their pet at the exam. And we don't want that, right? We want to reverse that, right? We want them to use the control so that we don't have the ticks.
But the show and tell.
Yeah,
really
it makes a difference.
It's
definitely.
An impact.
The Win Feline Foundation has been funding cat health studies for 51 years. If you have a cat or have ever treated a cat, nearly everything we know was once funded by this nonprofit, totaling about $6.5 million. From understanding retroviruses, FELV and FIV, to more recently targeting gene defects responsible for HCM in the Ragdoll and Maine Coon breeds. The Win Feline Foundation Pet Memorial Program offers veterinary professionals an opportunity to reassure clients that their beloved cats have not been forgotten, and those dollars support health studies that benefit the lives of all cats. Contributions totaling $150 or more receive a certificate suitable for framing or display in your clinic. Imagine being able to treat kidney disease more effectively, using stem cell therapy to cure stomatitis, or drugs to treat FIP are actually within grasp. Consider your support in telling your clients about the Win Feline Foundation and a free newsletter at winfelinefoundation.org.
But I think that especially in feline medicine and also in the D word medicine, I think it is so important that we talk preventative medicine instead of therapeutic medicine.
Yeah,
absolutely.
And we're getting back to this again. So we always have this discussion about, it's difficult to get cats into the veterinary practice. This is one of the reasons why you should, or at least educate your owners the right way, that prevention is the key.
Yeah.
Right.
Yeah. You can prevent some pretty serious diseases. So I want to make sure we talk about heartworm, because there's another disease that is still to this day thought more of as a canine problem. But we know so much more about heartworm in cats. It looks different, right? So let's talk a little bit about, what does heartworm look like in cats?
Well, it's again that respiratory disease. So when it manifests clinically, and sometimes it's just a quiet cat that's quieter than it used to be. Well, the reason that it's a quiet cat is he's having trouble breathing, can't be as playful, can't be as energetic because of that heartworm-associated respiratory disease, the lung damage that the heartworm causes. Yeah. And, the heartworm is not supposed to be in the cat. Yeah. And the cat knows that. The immune system responds really strongly, kills the larvae, and all that inflammation just wreaks havoc in the cat. And so it's so much better if rather than having the cat's immune system kill the larvae, if we use a product to protect the cats. Yeah,
the poor heartworm never intended to end up in the cat, right?
It doesn't want to be
there. It's an accidental destination.
Right.
But I think the other challenge with heartworm in cats is that the clinical signs can mimic things like asthma.
Absolutely. Yeah.
And I know there are cats that have been treated. I know I've treated cats for what I thought was asthma, when they probably had heartworm-associated respiratory disease.
And we don't have treatment for heartworm in cats. I mean, our treatment is to put them
wait
on preventive,
out.
maybe give them some prednisone, get them through that crisis.
And wait it out.
But just wait it out.
Yeah. So prevention, again, much easier.
Absolutely.
Yeah.
So what happens then? I mean, they just die and then you
Well,
live
they
a happy
can
life?
die. They certainly can die. There's
Or
been
they just
some
stay alive?
shelter surveys where they've done necropsy. I think Julie Levy did a project where she looked at necropsies of shelter cats. And that was one of the first times we realized cats can have more heartworm than they thought, but you can die from heartworm. You can correct me if I'm wrong, but I think a lot more cats just have clinical disease, right, and hopefully survive it, and they may even go undiagnosed.
Well, and we have challenges with the diagnostic test because the cat's immune system kills most of the larvae, so they only have a few adult worms, if any, and so the tests are going to have a harder time finding those infections. The cat makes so much antibody that what little antigen, what little protein from the worm is there to detect is covered up by the antibodies in most cats early in infection, so we can't detect it. We use antibody tests in cats, and that just tells us the cat was infected at some point in the past, or maybe it's infected now. Yeah. But what does that mean, right? So it's really it's a challenge.
It's often a presumptive diagnosis,
and you
right?
don't have a PCR for cats?
Well, so for the PCR, we'd have to have the DNA of the parasite to detect, right? And the cats don't have circulating microfilaria because, again, it's the wrong host, so the worms aren't as hardy, so they're not likely to be PCR positive.
Yeah. They're just a challenge. Do you think, because there was a time a number of years ago when we had this like sudden explosion of data on heartworm in cats. So do you think that awareness has been improving over time, or do you think it's still a challenge?
Yeah, I do think awareness has improved. I don't know if we've leveled off again, maybe. So I
worry we've leveled off a bit. Yeah.
I think what we need are better diagnostic tests to really reveal what is the infection pressure. What are cats under? Yeah. I mean, my cats are certainly on heartworm preventive, and they always will be. But I know a lot of even veterinarians that don't have their own cats on heartworm preventive, and that tells me we've not done a good job.
That's a really good point.
Parasitologists have not done a good job.
It's a really good
convincing
point.
People.
And I think the cats that are on heartworm preventive are only on it because they're on flea preventive anyway, right?
Flea and intestinal parasites, and honestly,
and that's okay.
Yeah, if you look at prevalence of infection, cats need to be on roundworm preventive for sure. Toxicarea cati is the most common parasite that we see in cats.
So another good one to talk about, because there is zoonotic concern about that, right?
Yeah.
And even in developed countries like the U.S., that is still a zoonotic concern.
Right. 1 in 7 Americans has antibodies to Toxicarea. We don't know if we got it from cats or from the other species. Yeah. But we got it from ingesting the larvated eggs, We were infected. We didn't go on to develop visceral and ocular larva migrans, thankfully in most cases, but still that infection commonly occurs. And it happens from soil or cat litter or sandboxes, anywhere an infected animal has defecated, deposited those eggs, they've larvated, and then those eggs, once they're in the environment, you cannot destroy them.
Yeah, they'll survive a nuclear blast.
Oh my gosh, they're immortal. Yeah.
Yep.
Well, a prescribed burn will take care of them. But
but
they'll survive in formalin and in acid and in bleach. Yeah. They even still survive.
Those are the ones with the really. If you look at them, they have these
the rough eggshell. Yeah, really thick rough eggshell, and that helps them survive long term and go on to infect somebody.
I paid attention to my parasitology course.
Very good, very good. Yeah, but I think our children are somewhat susceptible.
Very
are they
much
not?
So. Yeah, they're more likely to be geophagic or put things in their mouths and become infected that way, and then they're susceptible to developing. Very young children get visceral larva migrans with lots of liver inflammation and eosinophilia, and then older children get ocular larva migrans and
can affect your vision.
Right, leads to vision loss, but it also resembles retinoblastoma. And so before there were better imaging techniques and before there was good serology in people, some of those children historically would have their eye enucleated because it looks like retinoblastoma. That doesn't happen anymore, but it does speak to the importance of these infections.
Wow.
Yeah, so let's talk about prevention a little bit here for people. What should we do?
To prevent against getting toxocara?
Yeah. So the Companion Animal Parasite Council is always every pet, every month, all year long. And so we want every cat on something that will protect from roundworms, from hookworms, and then, of course, from heartworm and flea and tick.
So that's treating the cat. And then as a person, what should you do?
Oh, yeah. So with people, just being very aware of your environment. And so not watching children trying to prevent ingestion of eggs, which is difficult. You know, as a parent, I understand that you can't watch them all the time. But trying to reduce environmental contamination so that there's not that opportunity for soil ingestion and ingestion of eggs.
So cover the sandbox when you're not playing in it.
Yeah.
I mean, there's a couple of things. Wash your hands.
Absolutely. Yeah. Produce, wash produce carefully and never use dog or cat feces as fertilizer.
Yeah, or
and
compost,
think,
right? Yeah,
right. And then we joke about never going barefoot at the dog park. And you think, who would do that? But dogs
people
do
that do that?
Yeah, no, but dogs do that. So then they bring home the infections.
Not even dog park, beaches.
Yeah.
People take dogs to beaches. And that's now Yolla's like looking at me with great concern.
Yes. Okay.
There's a reason to. No. I have a
mountain holiday.
Because I travel a lot. I have a tropical medicine doctor, who gives me the vaccines I need for the places I travel. And he always reminds me about that.
Yeah.
That you can get like hookworm infestation from areas that you would not think. And he always mentions places like beaches.
Right.
Yeah. But you mentioned the Companion Animal Parasite Council.
Right.
So I did want to make sure we talk about that a bit. We'll put a link in the notes. CAPC. Good for you.
CAPCvet.org.
I'm really impressed. Yeah.
So she normally thinks I'm a total nitwit on these kind of things, but I'm proving myself today.
He is.
Thank you, Susan, for being here.
My estimation
the Susans bring out the best.
I tell you, you should talk to us more often.
As a matter of fact, during my veterinary career, I was almost chosen to do a special student. As a student, you can get jobs to help.
Yes.
And it was tropical parasitology.
Really?
Yes, I loved it.
Oh, you're you're a multifaceted person.
And before we go away from this, because we're focused on the US, this is a problem that's everywhere.
Yeah,
absolutely.
Because our audience is from everywhere. So I just want to be sure that it is Latin America, it is Australia, it doesn't matter where
Europe,
you are,
everywhere.
it is everywhere.
Yeah.
Right.
Okay.
And roundworms are in cats everywhere.
Sure. So tell us a little bit about CAPC, the Companion Animal Parasite Council.
Right. So it's a board of veterinarians and parasitologists who come together to make recommendations about parasite control for cats and other pets.
The other species.
Yeah. And so, and they've recommended for many years, every cat, every month, all year long. Mm-hmm. And so I often we talk in dogs, we talk about heartworm prevention, and then it gets intestinal parasites too. In cats, I really think we need to think about roundworm prevention, and then it gets heartworm too. Yeah. Heartworm really matters in cats, for sure. Yeah. But the roundworms are so common.
Yeah.
That
it's an easier explanation. It's an easier buy.
Yeah.
Right? If you will.
It still seems, I think your point about flea control, pairing it with flea control is really critical because it still seems that a lot of owners, if they don't see it, how important it is. And sometimes the cats help. They'll vomit up a worm, right, on the kitchen floor. And that's sort of undeniable.
But I think it would help if the flea flea was like 25 centimeters and hopping around, so people would realize that,
but,
oh my God, what's that?
But it does make an impact on owners when you show them a flea on their cat, because they may not,
absolutely.
and then they get all creeped out, right?
Real. Yeah. Or a video of ear mites, right? The reason we recommend this is it provides control for ear mites.
I love the test when you show the flea poop and it's
and it turns reddish brown.
Yeah, and it turns red because that's the blood of your pet.
Yeah. So do you get pushback?
Last question, by the way.
Okay, last question.
Almost there.
Okay, it's an important question. Yeah. So the every cat every month thing. I say that, and I'll have veterinarians even who say to me, "That's overkill. That's too much. Like it's an indoor. It lives on the 19th floor of an apartment. You know."
Yeah.
So what do we say?
Well, one of my questions for veterinarians, not to owners, is, well, when do you want them to have parasites? Right? That's sort of that's what you're doing. Answer. It's like, because people say, when can I go off my tick control? And I say, when do you want to see ticks?
Yeah.
I love that.
That's a good
now
idea.
I know what to say.
And the problem is, it's not overkill. The problem is we don't know when that cat is infected. Yeah. If we could test them constantly and survey them constantly and, have a cat cam on them all the time to know when they got infected, then we'd know when to treat, but we don't.
But you don't.
So it is that monthly treatment is what we do because we know reinfection is common. Yeah. And we've seen that with some of the intestinal parasite testing that's available now. There's the fecal flotations that we've always done to look for the eggs, but that's kind of late, right? Because now the environment's already contaminated. So there's antigen testing that can tell us there's an infection there, even if there's not eggs.
And this is fairly new.
Yeah. And what it shows is there's more infections there that we didn't know about because they're happening in between that monthly deworming system. And sometimes people get frustrated and they say, well, it's positive, but I'm giving the parasite control. And my response is, right, that's why you're given the parasite control, because the animals continue to get infected. The cats continue to get infected.
I love the fact, when do you want the parasite? Yeah. That is wonderful. Every cat, every month. That's from now on,
much easier.
So thank you so much for this wonderful podcast. It has been.
We learned a lot.
I know. It's amazing.
That was super fun.
Yeah. So
I love hanging out with you. I know. Yolla's not going to forget that. And I'm not going to forget the 25 centimeter flea either.
And the tick trickster or whatever it was. But no, thank you so much. A wonderful session. And
we'll have to talk to you again.
Thank you.
Yes,
that was very fun.
Thanks.
The opinions of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @Purr Podcast. Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kirpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX.